At the heart of the Singapore Hospice Council's mission lies a commitment to ensuring that no one walks the final journey alone. By setting national standards, empowering healthcare workers, and engaging communities, the Singapore Hospice Council ensures that quality palliative care reaches not just patients, but every person who loves and supports them. That mission starts by aligning care across providers and giving them the tools to improve together.
SHC provides the platform, and because it's an umbrella organization, people would then appreciate that it represents the voice of the community. We now have a clinical services committee, and there are people overseeing these areas. Because of this clinical group, it becomes a point of call when member organizations and their staff have problems. You'll come to this clinical group, and then they will try and solve it out. If they cannot, then it helps us to float these things to the ministry. We now have a forum that we can say, hey, I've got this problem, how do you solve it? Hey, we all have this problem, let's see whether they can manage it. And with that comes more helping hands. And so with more helping hands, hopefully then the people who need the care can get the care.
I co-chair the steering committee with Dr. Angel Lee. Dr. Angel Lee is also one of my mentors. This steering committee actually looks over not just the whole national palliative care quality improvement program, but it also kind of helps to contribute to the public education and awareness movement. As I went around with the national audits, I think what really impressed me was that everybody just wanted to do better for their patients. You know, they were asking like, how can we improve? How can we learn from the next better player? And therefore they were willing to come forward, share ideas, organize the national palliative care conferences with us. And that was so useful for us as services. And in terms of the national quality piece, it really made us feel like the fraternity was coming together to learn together.
There's a Chinese saying that says 万事起头难. Back then, frankly speaking, I have no idea what quality improvement was. It was really learning on the job.
But enhancing palliative care services cannot be done by the Singapore Hospice Council alone. The spirit of collaboration stays key.
It started as a scientific meeting of the Singapore Hospice Council, and we wanted to hold it every 2 years for people to not only learn but to share their work. Because it was organized by the local fraternity, it was a means for our local staff, our volunteers and all, to come together, to work together, to ensure succession in leadership planning. Because as you organize these conferences, you realize that it is a regular cadence. And you are practically training the next group of people.
This is an extremely good platform to really showcase and elevate the status of palliative care, not just within Singapore, but within the region, Asia-Pacific region, where you bring in people, like-minded people together and learn from one another. I think that is really one of the greatest highlights.
The SHC decided to focus on the guideline and also the platform for the different services to practice under an umbrella where it is standardized in certain ways. When I was doing the piece of work in caregiver survey, one of the biggest challenge was getting the buy-in from different institutions. As we know, in Singapore, all the palliative care services started at different point in time. So some of them are very established, some of them just started. Some of them has very strong IT systems, some of them do not have. So when we're asking them to collect data from patients' family, all these are extra work on top of the clinical work and the nursing work, and we do see that as a big challenge. That's why we are trying to meet somewhere in between, where we can actually collate this data meaningfully and put this together so that we can identify some of the areas that we can actually improve on at a system level.
With palliative care being a multidisciplinary approach, the Council is ensuring that the palliative care sector can support the needs of patients and their families even after their loved one has passed.
Grief and bereavement was a big gap in our services. We were seeing people in grief and bereavement every day, but yet when it comes to after death, there was really not much support. And therefore we came together simply because we felt this was important, and then we held all the grief and bereavement conferences since then.
Bereavement has always been a very inherent part of the model of care and the philosophy of palliative care. The belief is that care doesn't just stop at the point of death, but because it is those who live on that will have to now face the challenges that comes with the passing of their loved one. We strongly believe and advocate that bereavement would be a crucial part of the care that we deliver. It has always been the ethos of palliative care.
Over the years, more and more services got set up, and with each setting up of the services, they all joined SHC, which kind of fortified SHC's position as the peak body. All these developments, right up to the National Strategy for Palliative Care and subsequently more work with quality improvement, all these just build up to what SHC is today. 30 years on, being a very significant peak body and being able to influence the growth of palliative care in many ways.
As a society, how do we rally the community to actually take care of each and every one of us around us? And it's not just about leaving this work to professionals, but also participating in this together as one community.
Palliative Care 101 course is intended to basically encourage people to step forward, to basically volunteer in terms of being a resource person, creating awareness about palliative care. And this is very useful because why? They bring their own perspective into their own communities and are able to engage their own communities about how palliative care can help the wider community who may have needs. Without their presence, there's no awareness. There are no people to create like kind of signposts for them to ask for help when they need the help. And I think being embedded in the community, they actually enable us to give some feedback channels, right, about what are the other community needs. And again, it's really about partnership with people out there so that we can reach out and support the community in a better way.
If people are not aware of the kind of resources that they can tap on, what palliative care is, and how they can navigate this journey, they will face a lot of stress and a lot of angst as well as anger, bargaining or unfinished business. And it starts with understanding about their own health condition, their values, potential complications, and sitting down with their loved ones, having a frank conversation at home, in any setting. And sometimes it can be facilitated by an advanced care planning facilitator in the community and a hospital.
To be able to plan whatever you can plan at an earlier stage before the situation happens, right? One more thing planned is one less to worry, right? Be it financial, be it a will, be it nomination. Things are already in place that you can already make a decision when at a very, very early stage. So I think that's where we can do our part.
I have this great opportunity to come into contact with Singapore Hospice Council. That's where I actually signed up their palliative care 101 course. I do my part by raising public awareness about palliative care and also let them know that talking about death and dying is not a taboo thing, and try to remove the stigma about talking about that. And it can turn a difficult time of their life or for their family to a very meaningful and a gentle one. My role as an ambassador is not to do big things or grand gesture, but to plant seeds of awareness and compassion that ripples upwards.
In today's info age, digital age, there's so much information out there. How do you know that that is a credible source? So what is important for Singapore Hospice Council to push out the resources is that these are credible sources. These are done by the doctors, the nurses, the social workers, the specialist team. We want people to understand that the resources are safe for you to use, they are credible, you can rely on the resources. We push out helpline for people to just have a call. We push out telegram for doctors to just be one text away from professional specialist advice. And this is really creating a whole ecosystem.
On top of ensuring that the public knows about palliative care and is prepared when they become caregivers or when they need palliative care, the Singapore Hospice Council is also ensuring that services in the community are prepared as well.
Dying is a very personal process. How you want to die, where you want to die, is a very personal process. But it also means that the community must come in to support that person's journey. So it's important for us to have as many access points, as many nodes as possible. So we started to work with social service agencies who run active aging centres. People need not just come to SHC for information, they can go to all these neighbourhood access points where they probably would know the staff there very well.
We have a lot of information out there, but the access to this information, if not being told that there are information, they do not know where to go. So we have been working with SHC on signposting. Materials from SHC are being sent to us, and we help them to publicize their services, their educational materials, to educate basically the persons living with dementia and the caregivers and even publics that come by.
We engage leaders, change makers who can change from within an organization. And those conversations were created in a very safe space with fewer people, and for us to have more in-depth conversations. And we put SHC out there that we are a valued partner that you can rely on to provide you the resources, the connections, the professional specialist team, for you to be able to serve the people you serve better.
Leaders' engagement will allow us then to talk and address some of the things that the people working on the ground will otherwise not been able to address. And I think leaders coming together also have a twofold effect. When you have a leader who is already very much involved, it also helps others to say that this is possible and I can now play my part to be able to engage or even empower my own either community or my own organization to do things. It's not only restricted to healthcare agencies. Faith groups have a very important role. Given our multi-faith community, religious practitioners can actually help us have conversations. Death, dying and life is very much part of a lot of religions.
There is also another group of people that is rarely engaged when we talk about hospice and palliative care.
If you don't start now with the youth, you will always be playing catch-up. So we decided to engage the youths because we define the youths as tomorrow's caregivers, future patients. They may be now 15, 20 years old. In 10 to 15 years' time, they will be the caregiver. To start them first, for them to be aware where to go for credible information, where to go for help, where to go for support. Therefore, we decided to do something that's right up the youth's alley. We give them a problem statement, we empower them to come up with a solution, and some of these solutions we're turning it into tools that we can use. And that is really very powerful for youths, for them to own this cause palliative care.
From policy to practice, from hospitals to homes, and hands to hearts. The Singapore Hospice Council's vision of compassionate, inclusive care is built together, because real change happens when every voice, every role, and every heart comes together in service of dignity at the end of life.